Welcome, family. This is your girl Khensy, and welcome to my channel. If I'm new to you, hey, please like, subscribe, hit that notification bell, and let's get right into it.
Minister Ziambi has told Parliament that it's not the government's responsibility to help citizens in South Africa and they should fund themselves.
Chero South African akauya kuzogara kunoku, South African government haitumire mari yekuti munhu iye auye azorapwa neZimbabwean government. Asi kana ukauya ukasenza muZimbabwe, unosungirwa as a South African kuti unge une medical insurance emuno kuitira kuti urapwe.
So, I would like to start this conversation with a question. So, is it right for Zimbabwe to deny South Africans healthcare, but South Africans must give Zimbabweans healthcare? I mean, even if it's a legal South African who's working in Zimbabwe, Zimbabwean government does not give that person healthcare. That person needs to have insurance and pay for their own medical care.
Angry over pills. Lana, people were targeting you and just waiting for you to do something so they can come for you. Or Vela is the hatred that is always there and they're always ready to attack. Even when you're trying to do good, you are always trying to attack. Hi, because what the hell? We can't fight over pills. Free pills that you don't even cook in your own house. Free pills that you don't even make yourself. Pills that are donated from the outside. Pills that are coming from NGOs. Pills that can literally help someone live and protect them and their unborn child. You make noise about pills. You get angry over pills. Hi, when you're making sense, my way would maybe or apply Lisasa. Hi, so understand what I like to cross the line. I'm a police. Hi, no. Hi, Nyanivuma. Hi, Nyanivum. I agree you. Hi, Nyanivuma, Nyanisaba, actually.
So, not long ago, there was a man who got sick. The man was working in Zimbabwe and he went there legally, but he did not have medical insurance. So, when he went to the hospital, he was denied help because he didn't have insurance. And according to the constitution of Zimbabwe, they only offer medical care to their people. So if you're not a citizen of Zimbabwe, they're not obligated to give you medical care. You can say that it is inhumane for them not to do that, but they are putting their citizens first. So this man reached out to South Africa and said that I'm sick and I need urgent medical care. So the premier of Limpopo got him airlifted at the Bait Bridge, and then he got medical assistance here in South Africa. And he didn't have to pay anything in South Africa because as a citizen in South Africa, you do get free medical care. But also in South Africa, people that are not South Africans but are working here in South Africa legally, you could be a permit holder or whatever, as long as you did not come into this country illegally, South Africa does give you free medical health care. But other countries, you will not get that. So because ANC has eaten a lot of the money that's supposed to improve clinics and hospital, and when things get broken, the money is chowed to fix those things. Not that the money is not there, the money is there. Someone is just eating that money and The clinics and the hospitals are left with no option to just use whatever little resources that they have to cater for so many people. And then South Africans are feeling the burden of those people that are in power chowing the money. So there's little resources because you don't want to sit in a hospital the whole day and when you get there, they tell you that there's no medication. But you saw other people who are not South Africans getting medication. But you or someone in your family, if you're not paying taxes, because some people pay taxes, but they still, because private health insurance is so expensive, some people just cannot afford to get private healthcare. So they rely on the public health sector. That person is paying tax and they're not getting their their worth of that money. Or it could be a family member who is contributing to the the tax and that medication is being bought by someone whose family and that person is not receiving the care that they should. So when Operation Dudula is saying let's prioritize South Africans because other countries are prioritizing their citizens, why must it be different when South Africans have to be put first and they need to be prioritized? Why do we get labeled xenophobic? Why does the wheel get spinned when South Africa is saying let's prioritize us first? And there's nothing wrong with prioritizing your people. And it's not South Africans saying that we're not gonna give healthcare to other people that came here legally. We're just refusing to give it to people that came here undocumented, illegally, because that is firstly a criminal offense. You must not be in any country without proper documentation. You must come properly, and when your visa or whatever expires, you must go back home. So tell me what you think down in the comment section. Thanks for watching. If you like this video, please click on the like and subscribe button below. Thank you.